order the 2021 budget public hearing for this year. And can everybody hear me now? I think my mic was off. So I'll go ahead and turn it over to Bryant. Bryant, you can make a presentation.
Thank you, Mr. Chairman. I'll basically give the same presentation I did last week, and then we'll open it up if there are any comments from the public. I think a representative from the fire districts are here. They were here to answer any questions that the public may have, so we'll go through this fairly quickly. As I said, last week we started the meetings in late January, ended at the end of February, and the course drastically changed since the COVID-19 came into play. Before that, at the planning session, we talked about some major initiatives that we would handle for this upcoming year, the classification pay plan study for employees. We would do a couple of things to focus on our response times, adding some telecommunicators for the sheriff's office, as well as looking at a base in the Clyde area to lower the response times for EMS. And then modernizing facilities was doing an improvement at the Waynesville Library. We were talking about a $600,000 or $700,000 renovation. All of those plans were shelved because of COVID-19. It's had a huge impact on our revenues, and I'll quickly go through those. You can see we've got a decrease in general fund revenue of about $2.4 million, or close to 3%. Initially, we had projected an increase of over $1 million, so the adjustments that we made from the end of February to where we are now really felt like a decrease of about $3.5 million. So a total general fund revenue of just over $81.5 million. The largest part of our general fund revenue comes from real estate, personal property, and utility taxes. This totals almost $41 million, a growth of only $157,000 for next year, or 0.39%. Give you some context, last year we had growth of $800,000. One of the reasons is that we've lowered the collection percentage to 96.35%. That's the same collection rate as we had during the recession. We hit that collection rate in 2009 and 2011. By statute, we could actually budget 97.74%. That's last year's collection rate, and that equates to about $515,000 more if we budgeted at that collection rate. But the recurring theme that you'll hear through this is that we've been conservative on our revenue estimates just because we have so many unknowns. So we're taking a very conservative approach to revenue estimates. Motor vehicle tax, a little over $3.9 million. I don't have my glasses with me. An increase of $157,000. Last year, comparatively, we had an increase of $471,000. What's to note is that the state has extended your tag renewal for April, May, and June. We don't know if they'll extend that further, so we've taken another conservative approach to wonder if the state, because of the economy, extends that deadline. So an increase of $157,000. Sales tax is where we really are feeling the pinch from the pandemic. We've decreased sales tax by $2.5 million, or 15.62%. Sales tax was tracking to come in at about $17.3 million next year. So it really feels like $3.7 million reduction in sales tax. And that really has been the reason that all of our plans have been shelved. And if our estimates come in better than what we've estimated, we can always amend the budget. I think we've talked at length, if we track sales tax and we are projected to exceed it, we can add some of those things we've cut back in. Restricted intergovernmental is a little over $12.1 million, almost 12.2. Most of these are tied to HHSA programs. It's an increase of $724,000. On the expenditure side, we'll talk about it, but we've received boarding home payments for foster care, an increase of $416,000, daycare facilities, an increase of $139,000, and Medicaid reimbursements of $159,000. All of those give us the increase of about $724,000, but they are restricted to pay for usually some type of social service program. Sales and service, majority of these revenues are tied to EMS calls or ambulance services, a decrease of 16% or $949,000. Calls for EMS services nationwide are down about 20%. We're continuing to track that. Earlier today, we feel like we're on an uptick, so this number may be conservative as well, but right now it's just unknown when people will start calling 911 for ambulances again. We know that we'll come back, and as visitors come back to Haywood County, we're likely to see an increase. But there again, we don't want to miss it and overestimate our revenues. All other revenues I've combined just for presentation purposes, $5.9 million, an increase of just under $80,000 or 1.36%. This includes occupancy tax, the payment in lieu of taxes we get from the federal government, beer and wine tax, and investment earnings. Interest rates are down, so we've kind of reduced our investment earnings estimates, but we do have an increase there of just under $80,000. Any questions on revenue that you'd like to talk about?
You might just say how you came up with the sales tax revenue. I thought that was interesting, Bryant.
Okay. Well, what we did is current year, we reduced collection estimates for March, April, May, and June by 25%. And then for July through next June, we reduced actual collections for current year by 10%. So overall, it equates to that 15.62% decrease, but that's how we did it. And because there's a 90-day lag in sales tax, we don't have a lot of data from the middle of March when all of this has occurred. So we're using prior year data to provide a projection, but really we're I don't want to say we're driving blind, but there's a lot of unknowns there that make it an uncomfortable projection. I hope I've missed it on the right side. April's retail sales were down just under 17%, and we've dropped them 25% because we rely so heavily on tourist dollars for sales tax. We're taking a very conservative approach. Like I said, some people are reducing it by 10%, some by 15 and 20. I'm hedging at 25% just because we get so much money from sales tax from visitors. On the expenditure side, the general fund budget's only up $300,000. This equates to 0.34%. It's worth noting that we've cut about $4.75 million out of the request to get to this $300,000. So there were lots of things requested that we stripped out to make sure we brought in a budget as lean as we could. This shows by function where the changes are. We've had increases in health and human services, general government and public safety, decreases in cultural and recreational, and the budgetary accounts, the far left side of a decrease of $2.1 million. We budget employee merit and COLA increases in a central account and then spread it through the general fund, and this is largely where that's at. We also have a drop in our debt payments, and we have the way we handle the debt payments for the school and the college based on sales taxes in this account too. So all of those total a decrease of about $2.1 million. I'll get more on the employee raises as we get through the presentation. Like I said, we cut about $4.7 million out of the budget. We had a request of 14 positions. If we were to fund the positions, include salaries and benefits, some equipment, it would be over $900,000. With our revenue projections, it's just not the time to add those. You can see 8 telecommunicators, 2 for income maintenance at social services, 2 public health nurses for our schools. We had a processing office assistant for HHSA and a community paramedic position. The community paramedic position really hurt because that's a partnership between us and the hospital where they pay the first 2 years of the cost. We only have to purchase an SUV, and we've cut that out in order to bring in a budget that's fairly flat. On the compensation side, we have no reduction in force and no furloughs. I think for the most part, our operations are just as busy as they have been, or they're starting to tick back up. Ambulance services has been down, but we're seeing an increase. Our folks that have been closed to the public, like the librarians or our Parks and Rec, they filled in ways to help with the call center and all sorts of things like that. So right now we don't plan on any reduction in force, no furloughs. The bad news is we have no merit, no COLA, or no Christmas bonuses budgeted. Each percent is roughly $300,000, and just because of our revenue prediction, we're not going to be able to fill those. We also are evaluating filling vacant positions for current year. We have, I believe, 26 positions currently vacant. I've authorized 9 to be filled, but the goal is to leave positions open as long as we can so that we can save money where they're not absolutely necessary to fill. I do want to point out that evaluations will still be completed by their supervisors because we are going to get back to a merit increases, so we don't want to get out of the habit of doing your annual evaluations at the department level. Any questions on the compensation side? School funding, it does increase school operating by $227,000 or 1.38%, and it holds their capital flat at $900,000. This does fulfill the funding formula that the board adopted in, I guess, January. So we're on the same page with the school system. We also, this money doesn't include the $750,000 that we provided to the school system a couple meetings ago for the renovations of Annex 2. Per pupil funding actually has increased 2.75%, but because the population, the student population has dropped, it equates to an increase of 1.38%. College funding, we've increased their operating by 3%, roughly $87,000. You can see a decrease, a significant decrease in their capital. Went from 425 or 417 current year to 30,000. The college capital was all based on sales tax revenue. What this year is kind of an in-between year for the college. They want to accumulate more sales tax revenue, and next year's request should be back up to a level that you've seen historically in that $360,000 to $400,000 range. County operating, when you exclude the schools and the college, it's up $1.5 million. But let's talk a little bit about the detail of it. Foster care payments are $831,000 of the $1.5 million. And from the other slide, restricted intergovernmental, you see we got about $416,000 more in payments from the state. So part of the increase, the county's picking up. This is not really at our discretion to fund. There's a formula you punch into the state template, and it gives you your estimate. And so we're budgeting what the state has given us as their estimate. And that's an increase of $830,000. We have $426,000 budgeted in increase for data and network storage. Our systems, we have 2 different server systems, if you will. And one of them we paid cash for in 2015. It's obsolete, and so we have to renew a lease to pick up that equipment. But because what we have in our other location is aging, we have to update some of it so the 2 will talk to each other. So it's a huge increase this year. Been working with Joey, and he's working with vendors even this afternoon. We're trying to get that number down, but right now that's our best estimate of what it's going to cost to get our data and server systems up. It's a horrible year to have to pay that, but really no way around it. We do have an increase of about $100,000 to complete the FY21 reval. It's coming up. The values will be effective January 1, so the clock's ticking. but COVID hasn't delayed that. We're required to do it, and so we'll have the value set in January. We have $47,000 increase planned in utilities, and we have about $45,000 increase in the state share of the excise tax for Register of Deeds. We also have an increase of $26,000 for travel and tourism. Both of those are offset by revenue, but we still have an expenditure increase. Any questions on county operating? Okay. Capital, we have budgeted of $1.3 million. That's not counting the schools and the college. Real quick, we have, I guess that's 14 vehicles that we're recommending to replace. Cost of just over $640,000. You can see, by and large, most of them are for public safety. We have a facilities replacement vehicle and a mid-sized SUV for health and human services. Everything else is public safety. If we don't replace vehicles one year, it just backs up. The aging fleet impacts the time they spend in the garage. So it's just kind of a recurring cost that we have to fund. So 14 vehicles. I think we did cut one out after Chris and his guys looked at it. We did pull out one vehicle. Major capital items. We have some funds for the audio and video in this room. We started streaming this meeting 3 or 4 meetings ago. I think we can improve the cameras in here. The sound needs to be improved. Really not on those that view at home, but in here the sound's not great, so we have some funds there. We have some equipment that we're going to buy for animal services as far as a cleaning machine and radio equipment for the vehicles. We have about $300,000 for general maintenance of our facilities that's doing improvements of roofs, of parking lots, those kinds of things. We have some security equipment upgrades. We have a microfilm machine we're going to replace, a fingerprint machine we're going to replace, a $42,000 dishwasher. That may raise an eyebrow, but this is a commercial grade dishwasher in the jail. It runs 365 days a year, 3 meals a day for a population of over 125. So it's at the end of its useful life. We've tried to repair it. It's time to just replace it. And we got almost 15 years out of it. And then we have a water flush valve system, which will cut down on the number of times a commode can be flushed. So maybe we have less overflows and staff time addressing that. Any questions about capital? So basically, we have a shortfall of about $6.3 million. Give you some comparison, we had a shortfall of $3.6 million this year. So it's a significant increase. But keep in mind, we lost $2.5 million in sales tax, and we lost $949,000 in EMS revenue. So both of those basically are the reason that we have to have an increase in the appropriation of fund balance. We're financially healthy. Our revenue projections are conservative, and we'll continue to monitor it. And if you have any other questions on the general fund, I have a few other funds that I'll walk you through. Okay. We have an internal service fund for employee and retiree health insurance. It's unchanged at $9.9 million. We have a workers' comp fund. It's actually a decrease of $69,000. It's budgeted at $356,000. E911 fund is $482,000. All of this is an estimate from the state. It's an increase of $48,000. Solid waste at $6.3, almost $6.4 million is a slight increase of $13,255. We have a separation allowance fund for sworn law enforcement. It's no change at $65,000. We have the road district fund. It's a budget of $241,000. It's an increase of $106, but we have no rate change associated with that fund. And the cemetery district for Junaluska is $275. It's an increase of $40,000. The last one I'll talk about is the fire district fund. It's a total of $4.2 million, an increase of $27,802. But and it's probably small to see on your screens, but there are no rate changes from any of the fire districts. Everything that was current year is the same for next year, and no rate changes. So what's next? Next Monday, or this upcoming Monday, June 1st, you can consider budget adoption. And on June 15th, if we don't adopt a budget on June 1st, would be the fallback date. Be glad to answer any questions you have, or if there are comments from the public.
Could you give us an update on, last year the elephant in the room was the health care plan. And we rebid that to Aetna, and that's turning out real well, correct?
We made the change effective January 1, so we only have a couple of months of experience to look at, but it's trending very positively. And so that's why we have no change in that fund. Right now it's coming in under budget for the couple of months that we have the data, and hopefully that trend continues. That was the right call to move to a different provider.
Go ahead, Ryan.
The solid waste fund, we were talking about that a little bit earlier today. As of March, there's $14 million in there. We paid out $5.4 million to do the cap, so that leaves us about $9 million in there, and we're going to collect another $6 million this year. But when I look at it, we only need about $5 million to pay the expenses. Why can't we lower that?
So the CAP project itself was the 5.4, but we also had some funds set aside for the stream crossing. I think that number, I don't have it in front of me, was about $500,000. And then we had some professional services as well for the engineer and the quality assurance portion. So those two added about another $1 million, or those three things added about another $1 million to the cost. It's about 6.5 million. You're right, that we have a strong, healthy fund balance, and that was deliberate to bank some money in order to do this project. And so we have to have some funds there to do some improvements. I think there are, and David could explain it, but I think we have some improvements that we want to do to our convenience centers, to consolidate some maybe, or to expand others, because some of them are in need. You guys get more calls than I do about the shape of some of them. So it's worth looking at the convenience fee or the landfill fee, whatever we want to call it. But I don't really recommend, until we get this project done and everything tied up, that we cut that fee, because once you start digging in the dirt, things pop up that you're not ready for, and it's nice to have some cash on hand.
Well, I know just looking at it, there's going to be about $10 million left over at the end of the next fiscal year. I would think that would be more than enough. I know I hear about it all the time.
Yeah.
And people are expecting something to be done about it. And we're at the point now to where we clearly don't need $10 million, because we're going to be collecting the next year's revenues behind that. I don't know what it's going to look like. I know we had talked about it one time before. I don't sit on that board. So
if it's okay with the board, we'll bring back something and show kind of an outline year budget, and certainly look at that rate, but I don't want to commit that we're going to have $10 million just yet, because we do have some improvements we need to make, plus we also need to have some cash on hand to operate. So if all right with you, at the meeting on Monday, we'll bring something back.
Yeah, I'd like to see something then. On the capital outlay, the vehicles, just in conversation here lately, one of those positions has been moved to more of a clerical support type person. But yet we're still looking to add another SUV. I don't have a problem buying ambulances, but I got a real issue with buying SUVs.
Okay.
What's that for? Is that one that's giving us a fit, or?
You know, we have the information. This is a replacement, and it's met our replacement criteria. I can certainly get my file and look and see exactly which vehicle it is. It's probably aged out either by mileage or cost per mile to operate. If it's one that's given us a fit, we'll go ahead and replace it. So We can look at that.
Well, I know-
And I think it was actually requested as a full-size SUV, and we cut it back to a mid-size replacement.
But it's not for the community medic or anybody, it's for somebody that's in supervision or something along those lines?
Correct.
So we could cut it out because we don't need to supply one, is kind of where I'm headed with it, because if we're going to downgrade that position and it's going to be more of a clerical type position, then that goes along, and it's not a lot of money, but when you look at it, it's a fairly good, decent amount of money. On the fire marshal's vehicle, I don't know anything about that. Is this a change from the SUVs that they normally get, or are we looking at doing something different? I noticed it was a pickup truck this time.
We have we actually made that change this year. It's cheaper to buy the half-ton truck and then put a camper top on it than the same size SUV. So we did it as a way to save some funds. But with the camper top, it's still, you can store your gear and it still gets locked. So I think it saves about $10,000 or $12,000 doing it this way instead of replacing it with SUV.
Well, when you figure out the EMS vehicle, if we're going to be down one, the one that's mileaged out or aged out or whatever met the criteria, that might be somewhere to put that, and then you could eliminate buying both of them.
Okay.
That's all I had, Kevin.
Okay, okay. Anyone else have questions for Bryant?
No, I'd just like to say that, Brian, I appreciate you being available. You've called us all in individually and spoken to our concerns, and just appreciate the hard work that the staff's put on this. And I know Mr. Pless' comments about the solid waste. Brandon and I, Mr. Rogers and I are on that committee, and we've talked about all those things that you just said in front of everybody, so, you know, we're all on top of it. But I think it is wise, the guidance that we're taking. Get the project completed, let the dust settle, take a conservative approach, and then move on from there. So without putting the cart before the horse, we'll proceed after the project's done, you know, with that. So, but I do appreciate the oversight that you've given. You've been available. You've answered many calls and answered a lot of questions. From me, I can't speak for everybody else, but I do appreciate your availability.
Well, thank you.
Your
Appreciate
guidance
it.
on this.
Anybody else have any?
I'm done ask out. I'm done ask all my questions, so you're good, Brian. I appreciate it as well. You know, I've spoken to you several times in person and on the phone, and appreciate you and the staff putting this together. I know we've got a conservative budget. It's a tight budget, but hopefully we'll land on the right side of the fence, and we can make some amendments or changes, you know, later on in the fall, hopefully when the revenues start coming back in. I feel pretty good about that, so I hope we are sitting around in October, September, making some changes. So thank you and the staff for being available, as you always have been. You've told us many times if we have any questions to call you, so I appreciate that.
Thank you.
Okay, so do we need to ask if there's anybody from the public to speak, I guess, at this time? Is that, I just, before we do that, I just was wondering, of the fire departments that are here, I appreciate y'all being here tonight. I know did anybody get to do any kind of a public meeting or anything at all? Okay, I think all this stuff hit about the time this was going to happen for you guys, because it seems like it was the third week of March, or around the middle of the third week of March, and that's usually towards the end of March, I think, is when y'all have your public meetings and stuff. So, and I think everybody has given a budget, right, Julie? So you've got all the fire department's budgets, and we've put them online to where the public can inspect them. And then if they have any questions, I'm sure that you guys probably have contact information on there where people can contact if they need to. So I hate that we have to do it this way, but this is probably the safest way to do it, to where, you know, the public can look and inspect, and then they can, you know, ask questions and everything. And then so between now and our next meeting, we can maybe, folks, they'll look at those. And they're online now, I believe Bryant said. So this people watching on YouTube or that watch this meeting later, just know that the fire department's budgets are online to where everyone can inspect those. And so we want to make this as transparent as we can, even though it's a hard time. We want to make sure it's transparent. So did we have most fire departments here, I guess? Is there anybody, okay, let me go ahead and just say this. Does anybody want to comment on the budget at all tonight? I think most of the folks here are here in case somebody does, but I don't. So if anyone would like to speak to the budget. I know the sheriff's here. Did you want to make any comments, Sheriff, or anything? Okay. All right, well, I appreciate y'all being here in case we did have some public comment. Did you go ahead, Brandon?
I just got a comment, Mr. Chairman. I wanted to say, since all these guys are here, that we appreciate you guys. I know that most of the fire departments are run off of volunteers, and if you would go back and tell each one of those departments our thanks. It takes a special person to get up in the middle of the night and go out and answer a call for free. And I know some of you guys may be paid, but for the most part, you guys do an awesome job. We don't have to worry about anything, and I just wanted to say thank you.
Okay. Seeing no one that wants to comment on the budget, I'll close that part of it then. And I do appreciate everybody. I mean, the fire departments, I'd asked Bryant if he would, and Julie if they would contact y'all and be here, and y'all were here. So I really appreciate that. And I thought this would be a good way to, where if the public did want to comment, they could come. So and stuff. And then you can be commenting. The public can comment between now and I think June 1st, we're going to maybe vote on the budget. So please send us any comments that you may have. You have a week to do that almost. So does anybody have any other comments that they want to make? I do want to thank the staff, and this is a hard time. I know it's a hard time for the fire departments too, the staffs that had to put together these budgets, because they were having to deal with the COVID issues, which basically I feel like have overwhelmed me as a commissioner and other commissioners, and I'm sure the staff, and I'm sure the fire departments and others out there, to make sure that we get the work of government done, as well as this pandemic part of it. So I appreciate everybody that's been working on that. Does anybody have any other comments at all tonight? Okay, make sure I follow my. Okay. Well, I'll go ahead and I guess I can entertain a motion to adjourn. Is that what we need to do?
So moved.
Okay, is there a second?
Second.
Okay, all in favor indicate by saying aye.
Aye.
Okay, we're adjourned, and thank you all for being here tonight.